Hi, my name is Nancy, and this is my YouTube channel on CRPS, also known as Complex Regional Pain Syndrome, RSD, and Reflex Sympathetic Dystrophy. In this channel, we will take a deep dive into CRPS, talking about what it is, how it's treated, and associated illnesses. So stay tuned for more. Today we're going to talk about spinal cord stimulators, also known as an SCS. Spinal cord stimulator disappearing. Hi, my name is Nancy, and this is my YouTube channel on CRPS, also known as Complex Regional Pain Syndrome, RSD, and Reflex Sympathetic Dystrophy. In this channel, we will take a deep dive into CRPS, talking about what it is, how it's treated, and associated illnesses. So stay tuned for more. Today, we're going to talk about a spinal cord stimulator being used for complex regional pain syndrome. Spinal cord stimulator is also known as an SCS. Spinal cord stimulator is a surgically implanted device. It consists of the generator and wire leads. The generator is programmable and is surgically placed either in the back or the abdomen. The generator, also known as a control center, contains the battery. The battery can either be rechargeable or just a battery set to last a certain length of time. The leads go from the control center to the spine and are placed where the surgeon thinks it will stimulate the nerve that's causing you pain. Step 1, your pain management doctor will refer you to a neurosurgeon. Step 2, the neurosurgeon will ask you questions about where your pain is and the quality of the pain. Is it burning? Is it stabbing? Is it sharp? Step 3, the neurosurgeon will do a spinal cord stimulator trial to determine where the leads should be surgically placed. And step 4 is the actual spinal cord stimulator surgery. So this is the generator, and these are the leads in the spine. With any treatment, you need to weigh the risk and benefit. As with any surgery, there are risks, but for someone with CRPS, there are some additional risks. The risks include, but are not limited to, infection, anesthesia complications, spread of your CRPS, movement or migration of the leads that are in your spine, loss of effectiveness, and it can only treat one area, one limb. The benefits: it is a drug-free form of pain management, and it can be programmed to different options. So if you think back to our shows, What is CRPS? And the centralization show, you will remember that CRPS involves the entire nervous system. The spinal cord stimulator can only treat the nerve or nerve group. CRPS involves overstimulated nerves. The spinal cord stimulator works by sending an electrical signal to those overstimulated nerves. Despite these two things, the spinal cord stimulator does help some people, and Danielle will share her positive experience. One of my doctors suggested a spinal cord stimulator for me. By that time, my CRPS was full body and centralized, but at that point, we did not know that it was. I was told that a spinal cord stimulator could reduce the pain in my right foot where my original injury was, which in turn might reduce my overall pain. They felt that the injury to my foot was perpetuating the CRPS pain. When you're desperate for pain relief, you often agree to something without really thinking it through. And that's what I did. One of my main reasons for doing this YouTube channel and my Facebook support groups is so that other people with CRPS can make informed decisions and not make the mistakes that I did. I did get some relief in my right foot during the trial, so I proceeded with surgery. To minimize the CRPS pain in the area of the surgery, I had the anesthesiologist add ketamine to my anesthesia, and we will talk more about ketamine in a later show. This was a same-day procedure. I was sent home with the following restrictions: no bending, twisting, lifting for 6 weeks. I was prescribed an elastic back brace to help prevent or remind me not to twist turn. Surgery went well. The spinal cord stimulator would not be turned on until I was fully recovered, because you don't want those electrical impulses to make the wires move before they have formed scar tissue on them to hold them in place. One morning I woke up and my bed sheets were soaking wet. I had a fever of 102. My surgeon saw me right away. I was admitted to the hospital. Infectious disease was consulted, and blood cultures and wound cultures were taken. Blood cultures is they take a blood sample from 2 different places and see if there's anything in there that grows. Wound culture, they use a sterile swab to check the edges of the wound and see if anything grows there. It did. Infectious disease wanted the spinal cord stimulator removed. I was started on 2 different IV antibiotics, each one twice a day. They could not close the incision after removing the spinal cord stimulator because of the infection. I spent 7 days in the hospital. I was sent home on 2 different antibiotics, both needing to be administered twice a day. Fortunately, I had a port, and as a nurse, I knew how to infuse the antibiotics myself. They also sent home care nursing for wound care. My spinal cord stimulator was in my back, and I couldn't see what was going on with it. I was required to see an infectious disease doctor once a week to be sure that my antibiotic levels were therapeutic. This is called peak and trough blood tests. Before the infusion in the morning, they would draw blood. And after the infusion was finished, they would draw blood and check for the levels of the antibiotic in my body. So that's what a spinal cord stimulator looks like. This is what my back looked like before the spinal cord stimulator was removed. When wound care was done, the nurse would measure how deep it was by taking a sterile Q-tip type thing and putting it in and marking and measuring how deep the wound was. I also had a wound vac to help the wound heal. And at this point, it was almost completely healed. It took 8 months of wound care and 2 months of IV antibiotics to heal. Hi, I have with me today Danielle, and she would like to talk about her spinal cord stimulator experience. Hers and mine are polar opposites, so I want you to hear from someone where it has been a success. So, Danielle, was the spinal cord stimulator your first treatment for your CRPS?
Yes, it was.
Okay. And what made you choose a spinal cord stimulator over the other options that are out there?
When I was diagnosed, I didn't know anything else about the CRPS. And the first doctor that I met with that told me I had the CRPS,
Mhm.
that's what he suggested to do.
Okay.
But because he didn't um, do everything right with my insurance company, it was denied. But I ended up going down to Jefferson and I seen Dr. Wu, and he's the one that actually put my stimulator in. I
Great.
did go around about almost 6 years not knowing what was wrong with me.
That
So
is very common, unfortunately.
yeah, and I was like actually excited that I knew what was wrong with me until I
Mhm.
got outside in the car and I looked up what it was and I didn't want it.
No, no, no. I also was very relieved, although in 1998 you couldn't just look something up in your cars. And I'm a nurse.
Right.
I never ever heard of it. So what?
Yeah, neither I
Good.
never heard of it and I worked in the medical field for 22 years.
What part or parts of your body was your CRPS in before your stimulator?
Um they're in both legs. I have two leads in each leg and they are two right where the area of my pain was.
Mm-hmm.
So apparently you only get one in each leg, but he gave me two.
He give you two
So
in each leg or two total?
yeah, I no, I have two in each leg.
Okay, well, that makes sense. If one of them wasn't exactly right, there's a backup. Uh,
Yeah.
and tell me a little bit about your surgical experience and your recovery.
The surgical part of it was totally awesome. I didn't have anything that went wrong or anything on that lines. Everything was pretty good. The doctor that did it, he's very awesome. I would recommend him if you need to get one.
Yeah.
Um, his staff, when you call, is very helpful. Most of the time, you get the grumpy old people on the other end, but
Right.
his office and him and his business are very awesome.
That's good. Has the spinal cord stimulator positively affected your pain? In other words, is it helping?
Yes, it did. It actually did. When I did the
Trial?
trial,
Mhm.
I was up and walking with no limp, no nothing after the third day of that being put in. So I was very happy to go and get the real one put in. I
Yeah.
don't really have any issues or problems. A few I had, but that we can discuss that in a little bit with your other questions.
Okay.
But it, I was probably a 14 in pain scale, and it brought me down to about a 5.
That's good. Is there anything else about your spinal cord stimulator that you'd like to share with us? And have you had any other treatments since it was put in?
Anything that I have to share is, if you're going to get one, make sure you listen to what they tell you to do. It was, they gave me what was called a BLT.
Hold on 1 minute.
Okay. Okay.
I'm going to ask you that question again. Is there anything else about your spinal cord stimulator that you would like to share with us? And have you had any different treatments after it was put in?
Okay. So what I would like to share, if you do get a stimulator put in, to listen to what they tell you to do. It's called BLT, no bending, lifting, or twisting, until they actually tell you you can go back to that. Because I thought I was good because I felt so good, but here I wasn't. So it just made it a longer process for me.
Yeah.
Also, when I met with my doctor about getting the stimulator in, he actually said to me that, you know, when we put it in, it may not be perfect at that point. You have to give it time. You can't have it put in and then 2 months have it taken out. You have to give it a little bit of time because they're putting foreign bodies in you.
Right.
Your body's not used to having all that stuff in your body. So,
Plus, you're recovering from major surgery.
right. Absolutely. When they say the 6 weeks, sometimes it's longer. I was pretty much good at the 6 weeks. Other than that, I have lost a lead, and what they did was they just went in and took it out, and because it was on a nerve, so then they put another one in and another part of my leg because they can't put that lead back where they took one from.
Gotcha.
My battery has moved. They make a pocket for your battery. That has moved twice.
Is yours in the front or the back?
It was in my back, and now it's in my front because I was having a lot of issues with it moving all around.
Right.
So now it's up front.
Also, when you talk about not having it taken out right away or waiting a while for it to work, they also can change the programming to find a programming that helps you more.
Right. Absolutely. There's a team of people that meet with you to make sure your levels are on the right way for your body. So in the beginning, they were at my doctor's appointments, but they've come to my house a few times to help me awesome. So that team that I dealt with, they are awesome. I love my doctor and I love that team that helped me get to where I needed to be.
And since then, have you had any other treatments or no?
Yes.
Okay.
I did start with the ketamine about 3 years ago, and that's helped me a lot too. My body can take absolutely a lot of pain. So I knew at that point I needed to try and do something else for myself so I could be able to do things and not being stuck in the house. Right. So I did do the ketamine. Now I stopped because we lost our doctor. Yeah. So now everybody around here, they all want you to pay cash. And being on disability, you don't get a lot of money, so you can't pay for that.
Yeah. And how has the spinal cord stimulator improved your quality of life as far as what you're able to do?
When I first got it, I was really good. I was not limping. I was getting up. I was going. I had gotten really sick, and I think when I got really sick and lost, they didn't move my arms or my legs. So when I was in the coma, they didn't do any of that. So when I came out, I had to learn how to walk again. So
Just
that was one of the reasons why
clarification,
that.
when you say coma, you do not mean ketamine coma, correct?
No, no, no. I was sick. I was
Okay,
really
well, I
sick,
just,
and I ended up in the coma.
okay,
Um, After that, when I had to learn how to walk again, that's when I started with the infusion, the ketamine infusions also, because I know that I had spoke to a few people, and they're the ones that told me, like, just go try it, see if
right,
it helps you. And it did. It actually did.
that's great. I'm gonna go back and edit out the part where she's sparking. So I'm gonna
Okay.
ask you that question again and let you record it. And I think it was. Is there anything else you would like to share with us about your spinal cord stimulator?
Well, the only thing I can really say is that, like, when these doctors talk to you, everybody's body's different. We might have CRPS, and me and you both have it in the left leg, but
All
mine's
right.
going to be different than yours.
Yeah.
So when you take that step to try it, you might get a different result than I got. So you always have, if you're going to do it, just give it a try and
Right.
just wait a little bit. Don't have it
Follow the
removed.
doctor's instructions.
Yes, absolutely. And you got to give it time. It's not like, um, you know, they're putting you're getting an injection, you're getting something placed in your body.
Right.
So that's what I learned, and I did it. And I would say within 7, 8 months, I was good.
Great. Well, thank you for your input.